Buchanan Group is a privately held company here in Indianapolis, and Flannery Buchanan is the funeral home company that Buchanan Group grew out of. So the Buchanan family has owned Flannery Buchanan since 1881 when it started. Buchanan Group, Flannery Buchanan, Washington Park Cemetery Association. We have a long history here in Indianapolis. It's family owned. We're very, very proud of that. I'm just so thankful to have had the opportunity to grow in the Buchanan group of families and to do what I can to help our employees, especially in the area of benefits. The healthcare issues that we have in our country, I think everybody knows. It's very difficult. There's no easy solution. I've been in charge of finding healthcare for our group since about 1999, so I've been doing this for quite a while. We have gone through a variety of different programs, always trying to have that balance of making it affordable for the employee and affordable for the company so that we can continue to offer the benefits. We've had a lot of issues with pharmacy costs. Those are the highest, those are the costs that grow the fastest and have for a number of years. And so we had to do something to kind of put a lid on that. And at the same time, make sure that our staff was getting the right pharmaceuticals, having the best that they can get at the best price. We have a small number of people that are on high-cost pharmaceuticals, and those are very expensive. It's typically the ones that you see advertised on television. And so those are always going to be the highest cost. But what we didn't know was if you work with certain pharmacy benefits managers, they can pass along rebates. They can help you with discounts. And where I think the pharmacy benefits manager we had before was not sharing those rebates and discounts with us because our costs were higher. There's just no doubt about it, they were higher. And so that's something that has been kind of eye-opening for us, for me in particular. Quite honestly, I guess I don't think a lot about the super high cost drugs. I don't really think a lot about those because those are there's such a low chance of that occurring. That's why we have reinsurance. That's why we have other things in place with our program right now. That's from the company standpoint. From the individual standpoint, if it were me, I wouldn't care how much it costs. If it's going to help my wife or a loved one, I want them to have that medication. Anything that we can do to reduce the pharmacy costs to our employees, that's a great thing. The likelihood is all of these folks will hit their deductible. That's the reality. It just makes sense to me and to our organization to just get the benefit costs, especially the pharmacy cost, as low as possible. I think as much as the pharmaceutical companies and the PBMs work out programs to maybe defray some of those costs for those orphan drugs, I think that would be a benefit. So I think as much as those organizations can work together, especially on these high-cost drugs, I think that will be a benefit to our country, to our society.